I'm wondering if you can talk a bit about the issues around health disparities in the Latino community, particularly related to obesity, type 2 diabetes, and fatty liver. And what are some of the things that you're doing in the populations with this new Southern California center that are going to change the trajectory of development for them?
Right. So, for example, as I mentioned, 50% of Latino children today will develop type 2 diabetes. By age 2 years of age, we're already seeing disparities in obesity in Latino children who are twice as likely to be obese by 2 years of age. So we think there's something about the early life period that affects their future risk of obesity, diabetes, and fatty liver. Non-alcoholic fatty liver disease is particularly problematic among Latinos. That's a relatively new disease. Most liver disease used to be alcohol-induced, but the predominant form of fatty liver disease is non-alcoholic fatty liver disease, which has increased 62%. And we're seeing that in children as young as 5 to 6 years of age, which in severe conditions will require liver transplant. Part of that is also a genetic issue. Hispanics carry a gene called PNPLA3. 50% of Hispanics actually have that gene, which predisposes them to fatty liver disease. And other than genetics, there's also lifestyle issues. So, for example, sugary beverages. Latino children consume sugary beverages at twice the rate of white children. And also, we're looking at environmental factors such as air pollution and other obesogenic chemicals in the environment that can trigger the onset of obesity and diabetes and fatty liver disease.
I'm really glad that you mentioned the built environment, which we know has can have such dramatic impacts on risk for disease starting even prenatally, but certainly having an impact on child development. And we see that here at Children's Hospital of Los Angeles.